I just want to also show that the USB can work as a stylet, and it can work as a stylet, I believe, better than a standard malleable stylet, because there is so much mechanical amplification created by the two bits of metal that you can actually feel tracheal rings when using the USB shaped like a malleable stylet. So I'm taking the USB, I'm inserting it down our tracheal tube, and I'm placing it pretty close to the end, and I'm going to take our proximal flattened tip. This is a unique aspect of the USB, a unique design feature, and it's basically a very simple way to create a stop point for the USB as a stylet. If we just had this like so, without the stop end inserted, you would have movement of the device inside of the tracheal tube. So if we were trying to shape it, for instance, and then pick it up, there might be some movement. But by having this flattened section, I can insert it into the back end of the tracheal tube. This is a 7.5 tube. And that'll work, by the way, with most 6.5s and then 7, 7.5, 8 tracheal tubes. It'll work fine. So I have shaped this device to now have a straight to cuff styleted shape, just like we did with our malleable stylet. I would use it the same way. I would put my thumb in a male at 23 centimeters. I would introduce this. It's got some give, so it's kinder and gentler. It's not going to cause any traumatic injury the way the tip is, and much less potentially injurious than a standard malleable stylet. But I'm inserting the blade, I'm showing you uvula, going to epiglottis, doing our tongue control, switching to my base grip, lowering my elbow down, improving our view. I can do by manual. And then I'm taking our styleted tube, and like I did with the malleable stylet, I'm bringing it up over the notch. And ideally, I'm looking at this, I want to see that distal tip. I'm going to give it a little bit more bend so I can see that distal tip. But I'm going in like so, and now I've introduced it, and there you can see the tip of the device just coming up over the notch. So this is using the USB the way I would a standard malleable stylet. I see the tip come over the notch, I enter the larynx, I give it that rightward twirl. The reason why I do that, we're going to talk about tracheal ring corrugation and inclination, but I give it a rightward twirl, insert it, drop it to 23, come out, pull out the USB. So the reason why on insertion with tracheal tubes, or actually even if you're using a Bougie, if there's any resistance as you enter the trachea, you're pushing this device this way. The trachea, as you can see, is going downward into the thorax. So I want to give it a rightward twirl because it then changes the declination. So instead of going like so, you can see that the tube now follows the orientation of the trachea. Additionally, and if you can zoom in here and show this, I have a left bevel tube. Standard tracheal tubes, they have a left bevel, and when they catch at the tracheal rings, rotating this tube like so disengages the tip from the tracheal rings. So it allows for the tube to drop. So I remember this by saying, if you hit the rings, turn it right. By the way, with a Bougie, if you hit the rings and there's any resistance, the same benefit will happen. You're hitting the rings, you rotate it rightward, we are lowering the angle, and we're no longer pushing up, and we're also disengaging from the rings. So whenever you hit the rings, turn your device rightward. So I've demonstrated how we can use the USB as a Bougie with more directionality, more control, more mechanical feedback. I've demonstrated how we can use the USB as a stylet.